Good afternoon. I'm Paul Irwin, Dean of the School of Public Health at UAB, and I want to provide just a synopsis of our COVID roundtable discussion this morning from the School of Public Health. I led off with a brief summary of COVID across the United States, in Alabama, and locally here in Jefferson County and Birmingham as well. It's extremely challenging to track the number of cases, especially in the state of Alabama, given the day-to-day swings in the number of cases being reported by the Alabama Department of Public Health. But as I make note, just yesterday, over 4,300 cases were reported, an average of 2,900 hospitalizations and 32 deaths. We're still in the midst of this surge. If you look at the actual epi curve, as posted, for example, on the New York Times data tracker, both for Alabama and for the United States, you might get some indication that there is just the first hints of a downward turn in the curve. And so the question is, have we reached our peak? Dr. Suzanne Judd addressed this in her comments, and I invite you to look at the extended video for Dr. Judd's part of the roundtable discussion. She certainly indicated that we're certainly not out of the woods, and that we may not have actually started seeing a downward trend, but there's perhaps just a little less anxiety with the most recent week's worth of data than where we were a week ago. So that's a good thing. I think one of the things that we're all going to look for is what the curve will look like by mid-September, because that will give us some indication of whether or not there was an extra surge, if you will, from Labor Day activities, including the mini football games that took place over that long weekend. I encourage you to look at the University of Alabama system dashboard. As Dr. Judd indicated, and I agree with her on this, it's a really good barometer of the number of cases because we track more closely the number of tests done and the test results here more in real time than the Alabama Department of Public Health is actually capable of, simply because of the large number of cases that they have to deal with. Dr. Russell Griffith also commented about the number of cases being seen in the hospital, that just in the past week to 10 days, there was just the beginning of a decline in the number of new cases being seen for admission, although the total number of admissions is relatively stable, relatively plateaued, but plateaued at, unfortunately, a very high level. Dr. Martha Wingate also gave us a brief update on the K through 12 screening testing program that she is leading with a great team of staff and faculty from the Department of Healthcare Organization and Policy. And it's encouraging, actually, that more and more schools throughout the state of Alabama are contacting Dr. Wingate to request screening testing be set up in their schools. So with that, perhaps some encouraging news on the COVID surge. We're certainly anxious about the end of this week and into next week. I encourage you all to continue to encourage everyone that you're around to seek vaccination if they haven't already been vaccinated, because that still remains our way through this pandemic. Please take care of yourselves and your families and have a great, healthy, and safe weekend. Thank you very much.